Okay, well, I hope if other people join us a little bit late, I hope I remember to let you in. Um, so welcome. This is our annual open enrollment Medicare session. I believe maybe some of you attended last year, so welcome back. It's going to be a lot of similar information. We go over what we call Medicare 101, but we also talk about what's changing for next year. So just a couple of disclaimers. I said before you all came in that I'm not a super Zoomer, and this is sort of my most complicated Zoom meeting to date. So hopefully the technology will work well, or well enough, and we won't have to, fumble more than necessary. Also, I mentioned, we did this live last year to about maybe 15 people in the room. Hold on, I need to let a couple more people in. Okay, a couple more people just joined us. All right, so I mentioned earlier that we are recording this. Hopefully the NCTV people will be able to edit it and take all of my ums out and my Zoom faux pas. But ultimately, we hope that we'll be able to show this on cable TV for those who do not have internet access, but then also later on their YouTube channel. So people can, who can't be here today will still have access to the information, which is what we did last year. If you want to watch the rerun, it's on the Norfolk Cable TV YouTube channel. And a lot, as I mentioned, a lot of the information is the same, but we'll talk about the changes for 2021. The next disclaimer is that we just went through Shine Counselors just went through the training this morning. So hopefully I updated the slides at least to what we have to this point. As usual, there are some information that we don't have. So for example, the Medicare rates, we don't typically get till November. So some of these slides will have the 2020 information. So I probably should have upfront introduced myself. I'm Sherry Norman. I'm the director of the Norfolk Senior Center and also a certified Shine Counselor for, I think it's 13 years coming up. And I also want to introduce Jane Dewey. Jane, could you wave to the group? Jane is our Shine Counselor volunteer extraordinaire. And Jane and I have been working, I think, pretty well, Jane, would you agree? Since the shutdown, because I am a Shine Counselor, I can do some pre-screening and get people some initial documents that they may need. And then Jane follows up. All Shine Counselors are working remotely, and Jane follows up via email or phone. So hopefully we'll be able to handle the open enrollment volume, which is always, I feel like Mike Pence, there's a little fly that just flew in front of me. We'll be able to keep up with the open enrollment volume this year. Jane came by yesterday and already picked up the list of like 15 or so people who've already been in the queue that need assistance this year. And we'll just see how that goes. Unfortunately, we lost Kathy Chianca. She actually got promoted, so it's not a bad thing. She's working as the assistant to the director at the HESCO office for Shine. So she's still with Shine, but we don't have her here dedicated to the Norfolk Senior Center this year. So, and maybe some of you worked with Kathy last year as well. Someone else waiting to get in. All right, so without any further ado, I think you all know open enrollment. Every year you can make a change to your Medicare plans between October 15th and December 7th for plans that are effective January 1st. What do Shine Counselors do? Shine stands for Serving the Health Insurance Needs of Everyone on Medicare. The E used to stand for elders, but nobody liked that. So now it's everyone on Medicare. And we're Shine, Florida is Shine. Most of the other states call it SHIP, which is a State Health Insurance Assistance Program, which seems to make a lot more sense than Shine, but that's okay. What do Shine Counselors do? We provide free, unbiased health insurance counseling to Medicare beneficiaries of all ages, because if you're under 65 but have been disabled for 24 months, you're Medicare eligible. Assist clients in finding coverage that meet their needs. answer questions regarding Medicare eligibility, enrollment periods and benefits, assist with Medicare appeals and billing issues, screen for public assistance programs, and pretty much anything else somebody wants to throw at us. We try to find the answer if we don't know. And it's one of the reasons I've enjoyed doing it for as long as I have, because every day, just recently I came across a question that I'd never had before, and I had to research the answer. And that's interesting to me, trying to learn new things all the time. So you all know your red, white, and blue Medicare card. I don't know if there's anybody with us who is new to Medicare, is going to be new to Medicare in the coming months. But you sign up with Social Security, and that used to be at an office. I would recommend at an office, but since the offices are closed, it's all online, and that would be at www.ssa.gov. If you are currently receiving Social Security, your Medicare enrollment will be automatic. However, if you're deferring your Social Security, you have to enroll in Medicare. This is kind of old news at this point. The cards no longer contain your Social Security number. Identity, gender of the beneficiary require a signature. It used to be, it was just your Social Security number, and that was obviously an opportunity for identity theft. So we'll have your name, your randomly assigned Medicare claim number, when you were first eligible for Part A and B. And you have to be careful when you do enroll, because the exact spelling becomes important, especially if you're doing things online. It has to be exactly as you have it on your card, which is why we always recommend before you enroll, if you're enrolling yourself, you want to have that card in front of you, or if you're working with a Shine counselor, have it in front of you so that they have the exact information. One time I came across a situation where somebody had, they were John Smith III, and I didn't have the third, and he enrolled in Medicare as a third, and I couldn't figure out why it wasn't working. So that becomes really important. As I said already, when you're entitled to Medicare is when you're 65. If you've got your quarters in for Social Security and paid Medicare tax for your 40 quarters, you're eligible. Or if you're a spouse or an ex-spouse of a 10+ year marriage, you qualify for Social Security and Medicare. Under 65, if you've been disabled for 24 months, or if you're entitled because of certain disabilities like ALS or end-stage renal disease. Enrollment periods. So we're talking about the open enrollment period, which is down there in the bottom left quadrant. You can change your health plans every year. Initial enrollment, which is above that, as the 7 months around your 65th birthday. So it's the 3 months before, the month of, and the 3 months after is your initial enrollment. And your Medicare is effective the 1st of that month, unless you're born on January 1st. But we don't have to get into all of the exceptions. And then there's also, and we'll talk a little bit about this a little bit later. Nope, reverse that. General enrollment. So if you missed, for some reason, if you missed your initial enrollment, you might have to wait until January 1st to March 31st. But then that doesn't become effective until July 1st. So you want to really, if you're new to Medicare, you want to make sure that you don't miss that initial enrollment period, because you might have to wait. And then there are a variety of special enrollment periods, qualifying events, move, when you retire, etc. So if you miss those enrollment period, your enrollment periods, either your initial or if you're entitled to a special, there is enrollment penalties. So, and these are lifetime penalties, which again, depending on how many months you missed, it could be expensive. So, so the idea is, if you're covered, it happens a lot, is if you're covered from an EGHP, which is an employer group health plan, you can defer your Medicare coverage until you no longer have that coverage. And you have to provide what's called evidence of creditable coverage, so that you don't get that penalty, which Part B is 10% of the current premium for every 12-month period you delayed enrollment. And you do have a special period of time to get that B after you no longer are employed. However, as a practical matter, people don't want any lapse in coverage. So, they typically get it for the month after they no longer covered by their group employer. It's important to also note here in red that a lot of people you have to be offered COBRA when you're separated from your employer. And some people do that for a variety of reasons. However, COBRA does not provide protection from the penalty for Part B. It does for D, just to keep it interesting, D for drugs, but not for B. And then the Part D penalty, just for fun, it's different, is 1% of the current Part D national base premium for every month that you should have had coverage, but you didn't enroll. So that's kind of a mouthful. And the reason it's on the national, we specify it's on the base premium, national base premium, which that is current for 2021. That number is because there are really cheap plans. This year we have one that's $7.20 a month for the premium, but that penalty is not on whatever cheap plan you might qualify for. It's on the national base average. So that's something that can also add up. So it's important to enroll. It's important to enroll when you're eligible. And we're waiting till the end for questions. This interactive thing is really hard for me because I like to see your faces and get immediate feedback. But one of the nice things about Zoom is you don't really have to be listening to me, and you can be making faces, and I won't know. But if you have questions, jot them down, and I'll answer them at the end. So 4 parts of Medicare, A, B, C, D. What could be simpler, right? It just sounds so easy. So Part A, and I think you all know this, is hospital insurance. Part B is medical insurance. And Part A and B together are sometimes referred to as original Medicare. Part C are the Medicare Advantage plans, which really, I call Part C the inclusive plan because it also includes your hospital, your medical, and your drug coverage for the most part, although there are some that don't cover medications. And then, as I said before, D for drugs. So what is original Medicare? So it was never meant to be the sole source of someone's coverage. I also learned something interesting. This is the 5th, well, I thought it was interesting because I'm kind of a geek about this stuff, but this is the 50th anniversary year of Medicare. And it was actually Harry Truman who tried to get it passed initially. And it wasn't until JFK came in and his dad had a stroke that he started thinking, hey, we have a lot of money, so we could take care of Dad, but what about, a lot of people who don't? And so he's the one who really brought it back to the forefront. And then after he was assassinated, it was Johnson who actually got it passed. And he brought Harry Truman in for the signing ceremony. Harry Truman had Medicare card number 1. Cocktail party conversation, right? So anyway, these are 2020 costs, and as I said before, we probably won't get those 2021 numbers for a few weeks anyway. But as soon as we do, I'll update this PowerPoint and get it out. If you want the PowerPoint personally to you or any other handouts that I may have, just let me know. Send me an email or a phone call, and I can get it to you. But also, we typically haven't put it out to last year, typically 1 year ago. We waited until we had the updated information before we put it on NCTV, at least the YouTube channel. So these are 2020 rates. The Part B premium this year was $144.60. If you are collecting Social Security, it gets deducted from your Social Security before it goes in, deposited into your bank. If you are deferring, you are billed quarterly for that B premium. And if there's no cost to Part A if you have your 40 credits in. Just a caution, if you do have an HSA, a health savings account, some employers offer that, and you could mess up if you apply for your Medicare with an HSA, because Medicare will go back 6 months to the first of your birthday month to give you retro coverage, and that there could be tax implications for that. So if you are thinking about retiring and you have an HSA with your employer, you want to stop contributions 6 months before you're actually going to go on Medicare. The IRMA, which is income related adjustment amount, is for those who are in higher income brackets. You would pay more for your premium. And this year, sorry, I'm looking for my notes. I think if you're under 87, Jane, you're going to fact check me here, under 87,000 for an individual or 174,000 for a couple, you would have paid the 144.60. Above that, you know, it's a graduated increase depending on your income. So oftentimes we get the question, well, you know, when I was working, I made the big bucks and I'm not making the big bucks anymore. So Medicare bases that premium on they go back to your 2-year tax return to determine what your premium is going to be. And there is a form, a reconsideration form through Social Security that you could fill out to have an adjustment down the road if your income drops below those levels. As I said, we won't know the deductibles this year, $1,408 for hospitalization and $198 for the medical insurance. We don't have those 2021 rates yet. Typically, they don't go down, so you can factor in a few more dollars for your premiums and your deductibles. And then co-pays, generally speaking, original Medicare is referred to as an 80-20 plan, and so Medicare pays 80% and beneficiaries are responsible for 20% of the rest of the bill. The exception would be there are a number of preventative services that are covered at 100%. And I do have a handout on that if anyone is interested. So Medicare savings programs, sometimes referred to as the buy-in programs. These are also last year's numbers. They are subject to change in the first quarter of 2021. There are 2 different programs. The senior buy-in covers more than the regular buy-in, but you can see what they pay for on this chart. The senior buy-in on the left pays for the B premium, Part A deductible, co-pays, and LIS, which is the low-income subsidy for the drugs. And the regular buy-in pays for B premium, and you're also deemed eligible for LIS. And those are the numbers. So family size 1 and 2, gross income, and asset limits. They did raise these last year, so more people became eligible. So if you're eligible or you know, think you might be eligible, you want to give us a call and we can screen you for those programs. If the only thing you're applying for is the buy-in, it's a fairly simple application process. So you want to let us know. So supplementing Medicare. So one of the things that makes this confusing is the terminology, supplement. So when I say supplement, I'm using it in the broadest sense, anything in addition to Medicare, but there are some actual plans that are called supplements. We'll get to that in a minute. So on the left, this is what I call my a la carte. You have your original Medicare, your A and B. You get a standalone Part D drug plan, and then you have an optional add-on of a private Medigap policy, which picks up where Medicare left off. And we're going to go into these a little more detail further on in the presentation. Or, a Medicare Advantage plan, which are managed care Medicare, like HMOs, PPOs. Those are the most common. Health maintenance organization, which you have to stay in network. You have a PCP, a primary care provider who makes referrals to specialists. A preferred provider organization works very similarly, although you can go out of network. Usually there are additional costs to go out of network. So on the left-hand side, you have maximum flexibility and portability. It works out of state. If you get a Medigap policy that covers out of the country coverage, whereas on the right, the Medicare Advantage plans, you have less flexibility and portability. Advantages to Medicare Advantage plans, which we'll go into a little bit in a minute, but it does include your drug coverage. So some people like that. I have one card that means it all, everything. Whereas on the left, you have your 3 cards. You have your original, you have your Medicare card, you have your drug card, and then if you have a Medigap policy, you have your Medigap card. So Medigap, as we talked about, also with Medigaps, there are discounts for new beneficiaries, which are not all companies offer it, but it's 15% the first year, 10% the second year, 5% the third year. For the first 3 years, you're new to Medicare. And that doesn't, you don't have to be 65, that if you deferred, it's just when you first pick up your B. Medicare Advantage plans. If you are income eligible for Mass Health or Medicaid, another thing that's confusing from a terminology standpoint, Medicaid just means subsidized Medicare, and in Massachusetts, Mass Health is the agency that administers Medicaid. And there are a number of different programs under Mass Health, and they have different income and asset limits. Retiree group employer health plans, pretty much going away for the last 30 years, but there's still some out there. And they, again, vary widely, much like an active group employer plan. They really cover whatever the companies have negotiated with the providers. So what happens often when, Jane and I are working with consumers, we never would tell you, oh, yeah, you wanted to get this. Well, number one, we never tell you what to do. And that's always a frustrating thing. People say, well, what would you do? Or tell me what to do because this is so confusing. There's so many choices. And I feel your pain. But our job is to give you options, and then you come to whatever decision works for you, because everybody's got, different needs. But when it comes to saying whether a group employer plan, a retiree plan would be better than something you could buy off the shelf, we really have to see the summary of benefits in order to compare, because again, it will be unique to whatever that employer has negotiated. VA healthcare for veterans, think of it as a parallel universe. It's really kind of its own entity. However, a lot of veterans get the drug coverage through the VA, which doesn't prevent a Part B late enrollment penalty, but would prevent a Part D. But there's also this year something new, which we'll talk about when we talk about Medicare Advantage plans. There are some Medicare Advantage plans that are targeting veterans, so they don't include drugs, because a lot of vets, as I said, get their drugs through the VA, but they still want maybe a local option with a Medicare Advantage plan, so they don't have to schlep into Boston or wherever to get their health care. Chapter 115 benefits is something unique to Massachusetts. And again, it's based on, these are 2020 numbers. Roughly 200% of the federal poverty level is roughly 2,127 per individual and 2,874 for a couple. And then you can see the asset limits. But it is open to Massachusetts veterans and widows, and it's a reimbursement program for out-of-pocket medical expenses that it's actually a great benefit if you qualify. And it's the main reason why towns in Massachusetts have a veteran service officer. So if you think you may be eligible for that, you want to contact our Norfolk, it's Bill Conklin, works through the town hall. Okay, so Medigap plans. Core and Supplement 1/1A. So we'll start on the left-hand side where we talk about core. So I'll say, I think I said this earlier, but in Massachusetts, we have it really easy with Medigap plans. Right now, there's core and Supplement 1A, unless you were eligible before for Medicare before last January, then you can get Supplement 1, but you can't if you were eligible after January. So let's say basically there's two choices. And then of the 7 companies that sell this insurance, it's standardized benefits. So again, we don't tell you what to do, but we would often say, why would you pay more for the same insurance? So Blue Cross has been the least expensive, or one of the 1-2 lowest costs for these programs. And so typically, if you're going to get a Medigap plan, you're probably going to get Blue Cross unless they wronged you at some point and you say, I'm never going to get Blue Cross. So on the core side, and these are 2021 numbers, premiums start, and this is Blue Cross's brand name for Medigap is MedX. So for MedX core for Blue Cross, this 2021, it's $107.88 a month. And what the core doesn't cover are the deductibles, the Part A and the Part B deductible that we talked about earlier, and also skilled nursing facility copays. It may include foreign travel. Neither of them include drugs. And again, that would vary by company, but Blue Cross does include the foreign travel in the core. Supplement 1, Blue Cross's name for this is MedX Bronze, and that covers everything that Medicare doesn't cover. So it would cover both deductibles as well as the 20% co-insurance. And last year, again, Supplement 1 is a new product because companies cannot sell policies that cover the Part B deductible. So Supplement 1A, which Blue Cross called Sapphire, covers everything but that Part B deductible, which this year was $198. And as far as the prices go, we're still waiting for some companies' numbers, but I really, I don't know, Jane, if you want to chime in here, I really don't think other companies are going to undercut Blue Cross. They certainly haven't in many years. That $180, however, is not Blue Cross. It's Healthcare New England, and they came in last year for the first time and undercut Blue Cross by $3 or $4, which is going to be the same this year. So, if you want to save that much, $3, you could go with Healthcare New England, or you could just stick with Blue Cross. But I'll let you know if that changes once we get the other companies' numbers. But typically it's been Blue Cross for a long time. Also, the supplement 1A covers foreign travel, and sure. I mentioned the graduated discount, 15%, 10%, 5%. Not all companies offer that, but Blue Cross does. So if you go to enroll and they don't bring that up, you want to make sure you bring that up if you're new to Medicare. Any questions, Linda? I feel like I'm talking to the screen because I am. So this is another way to look at the coverage in more of a table chart form. You see on the left-hand side, those are the services that are provided, and then you see what's covered. So under core, you see that those deductibles are not covered. And again, these are 2020 rates, 2020 Medicare costs. And supplement 1, the bronze, covers everything, but that's not available to people who are newly Medicare eligible. And then the supplement 1A, new last year, the Sapphire in Blue Cross parlance covers everything but the Part B annual deductible, which this year was $198. Now, if you are on bronze, you might want to consider dropping to Sapphire, because if you do the math, it's actually, even if you had to come up with that first couple $100, whatever it's going to be next year, not probably a whole lot more than that, it's still less expensive on an annualized basis to get the Sapphire than the bronze. And the only thing you'd have to come up with is that first $200 at the beginning of the year. So that's something to think about. Okay, Medicare Advantage plans, also known as Part C. I think they backed into that. I think they came up with the D plans in 2006 and realized they forgot C. So they started calling Medicare Advantage plans Part C, but I don't know that for a fact. Don't quote me. It's not going to be as interesting as the Harry Truman anecdote at a cocktail party anyway. So these are private plans that contract with Medicare. Another thing that makes it confusing is because they're all the same providers. They're all the same companies that we, offer Medigap plans and more. So what happens is it's a different model. These companies contract with Medicare to deliver Medicare services. And then they get a per capita amount for each of their members. And then they sort of decide how they're going to slice the bologna. So there's a huge amount of variety among Medicare Advantage plans. Most include the Part D coverage, as I've said. A few of them don't. And again, there's more this year because they're targeting veterans who may get their drugs from the VA. You always want to check the formulary, whether you're talking about a standalone Part D plan or the ones that are embedded in the Medicare Advantage plans. The advantage to Medicare Advantage plans are they can add some extras that Medicare doesn't normally cover, such as dental checkups, routine vision and hearing screenings, glasses. More companies are covering hearing aids, fitness benefits, This year, as I mentioned, we just had the training this morning. There seem to be more enhancements and incentives than I ever remember. So they really are sort of pushing people towards Medicare Advantage plans. As I mentioned, the premiums and the copays can vary greatly. So as it says a little bit later down on the slide, if you are considering a Medicare Advantage plan, I always say check with your provider, as long as you want to stay with your provider, and find out what they accept to narrow down your choices, because the devil's in the details and there's a lot of variety, so you really need some help narrowing that down. All of the plans have an annual out-of-pocket maximum, so, and those will vary. So if you get for example, a Z, that would be a zero. It's late. A zero premium Medicare Advantage plan, you may have close to a $7,000 or whatever they are next year out-of-pocket max. Whereas if you're paying more for the monthly premium, that might be more like $4,000 or $5,000. But again, that's kind of your safety net, where if heaven forbid, knock wood, you get have a serious hospitalization or something else happen, you'll have that. That would be your cap. Drug costs not included. The downside is, as I said before, it's less flexible. You might be restricted to networks. You may need referrals to see specialists. You can't enroll in a Medicare Advantage plan and a standalone drug plan at the same time. Medicare doesn't let you do that. And when you, in fact, or when you enroll in one plan, you're going to get kicked out of the other plan. So you need to be careful on that. Okay, so as I said, premiums start at zero, usually include drug coverage. So if you are in a Medicare Advantage plan now, your plans, you're getting inundated with mail because your plans have to tell you what changes they made, and all the other companies want your business. So, and I turned 65 this year. Happy birthday to me. So I get the same mail you get. Every day I get more postcards and stuff in the mail saying, please join my plan. So you can make a change now, as we said, October 15th, well, tomorrow, October 15th to December 7th for changes that will be effective January 1st. But then Medicare Advantage plans have a special enrollment. I kind of look at this as like one big enrollment, except you get a few weeks off in December. But you can, if you make a change now and you say, oh, you're going to try it in January and you don't like it, you have another opportunity to change again before March 31st, one time during that special enrollment period. And you could also at that time decide, to go back to original Medicare with a standalone drug plan and possibly pick up a Medigap plan. So, so you're not necessarily locked in the first time around, I guess is the lesson there. But you really always want to, every year you want to, which is why you're here, because you're the smart kids in the class. You want to, review your coverage, see what else is out there, and make sure that your plan is still working the way you need it to. If you had some changes or the plan didn't change something on you, that you don't want to be surprised come January. So Medigap versus Medicare Advantage plan sounds like a, oh, somebody's coming in. Someone's coming in late. Hold on. So pros and cons, we talked about a little bit earlier, but this is another chart, another way to look at it. You have, generally speaking, you have higher monthly premiums, but no copays, or maybe the deductibles, depending on which level you get with Medigap. But you also have more freedom. You don't need referrals. You can see anybody who accepts Medicare, and we haven't found any yet. Let's hope that continues. But you don't get the routine services, although most of the Medigaps are offering some riders for routine vision and hearing, dental. So you could always do an add-on if that works for you. And you're covered anywhere. Inside and outside the U.S. Outside the U.S., if you get the Medigaps that cover that travel. Medicare Advantage plans generally lower premiums, but you basically pay as you go. You might be restricted to a network, particularly with an HMO. You'll need referrals for specialists, get those extra benefits. And only emergency services will be covered with some exceptions. So for example, Aetna, which is a relatively new company in our area, last few years, I guess, they have a national network of like 40 states. So if you travel, but you like the Medicare Advantage model, you might want to take a closer look at Aetna. New for this year, telehealth, which, is again, one of the pluses of COVID. Telehealth was never or rarely covered, and now more, it's kind of one of the only ways to do it for some people. And so most of the Medicare Advantage plans are covering it, although they may be requiring a network, and there's either no cost for that or no more than what an in-cost visit would cost. Okay, D for drugs. I've never liked this slide, but if it works for you. So the standard coverage levels for Part D benefits compared last year this year, and they always go up. So the maximum deductible that plans can charge is $445. There are a number of plans this year that have no deductibles. Some of them are less than $445, but you shouldn't necessarily let a deductible, scare you, because it really does depend on your particular list of medications. Sometimes a plan with the deductible, if you look at the overall cost for the year, can actually be more cost effective than a plan without a deductible. And the only way to really determine that is to do the drug search yourself on the Medicare Plan Finder, or working with Jane or me to help you do that. The initial coverage limit is this year has gone up to $4,130. And so after that, you're in the donut hole, the coverage gap for Medicare, which we were told, I don't know how many years ago now, that donut hole was going to go away by 2020. No, it's never going to. Well, never say never, but and I don't. Is this true, Jane? Is it 25? Is it still 25% when you're in the? Or did that go up a little bit? Is it still 25% if you get into the donut hole for coverage?
I think so.
For brands and generics.
Yeah.
And then heaven forbid you reach that $6,550 threshold, then you're eligible for actually greater coverage, but you're in pretty, taking some pretty expensive drugs to get there. And then at that point, the cost sharing flips, and you're only paying 5% or no more than $370 for generic and $920 for a brand. So how to choose? As I said, the best thing to do is to call us, and we can help guide you through it. If you're computer savvy, you can go on the Medicare website yourself. I don't know how many of you have. A couple of years ago, they encouraged you to set up a My Medicare account. We can do that for you with your permission. I hope I'm saying this right. What that will do is a couple of things it will do. One is it will preload drugs, which can be helpful. However, it's not helpful. So for example, if you got some random drug for something you had, but you're never going to take that again, it will still show up on your list. So there might be some manual editing that you have to do to make sure that it's your current list of medications. Also, what was the other thing I was going to say, because I just had a senior moment. I'll come back to that. So let's start at the top. There are 9 companies, 27 plans. That's up from 2 last year. 3 are new. The Medicare Plan Finder, which we've talked about. Now, if you do want us to do the search for you, we have these pre-enrollment forms that we ask you to fill out, and either fill out your drugs on the back or attach a list of your medications so that we can more easily do that. I mentioned all counselors are working remotely, but we're open. The senior center is open Monday through Friday, 9 to 4. So if you're able to come in, you're willing to come in, drop things off, pick things up. We're still working that out. We can mail things, but just call us and we'll help figure it out. You can have Medicare do the search. That's Medicare's number, 1-800-MEDICARE without the E. Some pharmacies will do the search. Mass College of Pharmacy Outreach Program is very helpful, particularly if you have an expensive drug or an unusual drug. They can find programs that might be able to help with some of those costs. Preferred pharmacy pricing is still important. The big drug companies have preferred relationships with the big pharmacies, and you can save sometimes a substantial amount of money if you're willing to change drugstores. So it's another reason why, well, number one, you need to put at least one drugstore in to even do the search, but then you can put several in if you want to compare costs across a few that you'd be willing, and it's convenient for you to go to. We usually ask for at least two, so then you can, if you're willing to switch, you can check that out. But things, this is the big shell game. This is the thing that changes most every year, and so we always ask that you take a really close look at your drug plan coverage. So new this year, well, and some of you may already know this if you're on plans that have changed names. Envision is now Elixir, and SilverScript is back, but they're actually, the coverage is provided through Aetna, which has a relationship with CVS. And SilverScript is that cheap plan that I mentioned, it's $7.20. So just for the premium, but again, don't just always go with that low premium. You have to really take a look at your overall situation. However, if you take no drugs and you like the Medigap plus Part D standalone plan model, then you're going to be on SilverScript because why should you pay more for no coverage? And a lot of people do that because they like the Medigap model. But they don't, want to have a penalty down the road, so they just always enroll in the cheapest plan. Senior savings model, this is new this year. Well, sort of new. They're calling it, that's a new name. I think, was it Cigna? One company had a special plan, like a tier 6 plan for insulin. Last year, I think they might have started the year before, but no, this is a new thing that 9 plans are offering this senior savings model, and it's they don't all cover them quite the same way, because why would we ask for any kind of universal coverage? But if you take insulin, it's you want to take a closer look at those senior savings plans. Okay, if you need help with costs, here are some options. We talked about the buy-in and being eligible for LIS, which, by the way, you don't have to be eligible for both. If you're on the buy-in, you will be eligible for LIS, but LIS it's a sliding scale, so you could be eligible for LIS without being on the buy-in program. And Prescription Advantage, talk a little bit about that. Prescription Advantage is considered a wraparound. It isn't a drug plan. Some people get confused. They think it's a separate drug plan, but it's a state pharmacy assistance program. That's SPAP. There's a new language to learn, with everything, right? And in Massachusetts, we call ours Prescription Advantage. A real advantage to Prescription Advantage is it provides you a special enrollment one time a year outside of this normal open enrollment period. So it's kind of your get out of jail free card. So Prescription Advantage does not look at assets, it just looks at income, and they're fairly higher, they're higher income levels than a lot of public benefits programs. So it's worth looking at to see if you're eligible. It's really pretty easy application process, and it's just kind of good if you especially if you don't have to pay to get in it, which there is a high the highest income bracket. It does cost a couple of dollars to get into it, which really you have to look at your situation, see if that's worth it. But if you're under that, it doesn't hurt, might help. It's just good to have in your back pocket. It does have continuous enrollment, which means you can get in at the first of the month after they get a completed application. So worst case, you might have to wait a month to get the benefit, but it's just good to have. And I didn't mention on the Medigap plans, those plans also have continuous enrollment. So you can upgrade, downgrade, add, drop anytime. It's effective the first of the month after you've made the change. We already talked about Mass College of Pharmacy outreach program and health safety net. And Mass health programs, again, there's a whole host of them. Health Safety Net has no asset test, and it does also have a sliding scale income, which is a little bit higher than some of the other programs. And what's nice about the Health Safety Net is it will pay the hospital deductible, all or part, depending on what your income is. And so that makes, say, getting the core Medigap, you know, a little bit more attractive, because that's the biggest exposure under the core versus the supplement. And, you know, you'd get that hospital deductible covered. So Shine counselors can screen you for all the public benefits programs. And so if you think you're eligible, you have an option on that pre-enrollment form to give us your income and assets. Obviously, you don't have to, but if you want to be screened for other benefits, you would provide that to us, and we can let you know what you might get. Okay, so here's your homework. Here's your checklist. You know, you have to say, okay, is my plan still working? You know, what's my health? Did my health change? You know, what's my budget? You know, what can I afford? Can I find coverage maybe that's still, you know, works for me for less money? You want to look at your plan's cost and coverage and compare it to others. Always check the drug formulary, preferred pharmacy relationships. If you have a Medicare Advantage plan, if there's been some network changes, because ideally, you know, your providers don't change networks midstream, but it could happen. And so if you want to, if after having done all that, with or without our help, you decide to stay with your plan, you don't have to do anything. Just whatever you're on now, you'll be on in January. But if you decide to switch, we've already talked about your options for changing plans. The only thing I want to emphasize is if you are in a Medigap, you have to, unlike a Medicare Advantage plan or a Medicare drug plan, once you're in a new plan, Medicare will automatically disenroll you from your old plan. Medigaps don't work that way. So you have to manually disenroll yourself from your old plan. Otherwise, you're going to get 2 bills, and you don't want to do that. So now, this is the funny slide. Can everybody see that? I did it. You finished your novel? No, I chose the Medicare drug plan. And so you call us for your Shine appointment. You can call 800-243-4636, which is the general state age info number. You see down the bottom, 1-800-AGE info. Shine is option 4. Prescription Advantage is option 3. But you're just probably going to get kicked back to the HESCO office. Is probably going to kick you back to us. So you might as well just start with us. Save all that time and trouble.